Welcome to this explainer. Today we're diving straight into what has to be one of the absolute most brilliant, high-stakes acts of biological deception in all of medical history. Seriously, we're looking at a story of sheer ingenuity where two ordinary doctors managed to completely outwit an entire military machine and save thousands of lives in the process. And they did it using nothing but a microscope and, honestly, an unbelievable amount of courage. All right, let's set the grim stage here. The year is 1941, and we're looking at Nazi-occupied Poland. The local population was living under this constant, terrifying threat, literally a shadow of death hanging over their daily lives. The stakes for survival in this environment really could not have been higher, and ordinary people were desperate, just grasping for any way to protect themselves and their families from the escalating atrocities around them.
Section 1. The Anatomy of the Threat. The Twin Horrors of 1941.
To really grasp the immense bravery of this medical heist, we first need to look at the twin horrors that were completely paralyzing the region. Civilians were essentially trapped in a waking nightmare. On one hand, they faced the absolute brutality of the occupying forces, the Gestapo and the SS, who were ruthlessly rounding up villagers for forced labor or just summary execution. But at the exact same time, they lived in constant dread of epidemic typhus. This was a horrific, highly contagious, and very often fatal bacterial disease spread by lice.
But, here's where the dynamic shifts in a really unexpected way. The occupying forces were absolutely terrified of catching typhus themselves. The German military knew for a fact that an outbreak could easily sweep through and completely decimate their own garrisons. So, what did they do? They enforced incredibly strict quarantine protocols. The crucial thing to remember here is that if a typhus outbreak was detected in a town, that town was completely isolated. The German command would establish a total cordon, turning it into a forbidden entry zone just to protect their troops from infection.
Section 2. The medical loophole, a microscopic secret. So let's zoom right down to the microscopic level and see how an accidental biological discovery in the village of WWII provided this unbelievable opportunity. Enter a physician named Dr. Stanislaw Matalevich. While examining blood samples, he noticed a really peculiar anomaly involving the Proteus OX19 strain. Now, this is a completely harmless, dead strain of bacteria. But Dr. Matalevich realized it had one incredibly unique property. When subjected to laboratory testing, it perfectly mimicked epidemic typhus, but, and this is the key part, it did so without causing any actual illness or symptoms in the patient.
The mechanics of this loophole were just astounding. Basically, if you exposed a patient's blood to this harmless bacteria, it triggered a definitive false positive on the standard Weil-Felix test for typhus. So the official medical paperwork would show a severe, highly contagious infection, yet the patient sitting right there in the exam room remained completely healthy and vigorous, with literally zero symptoms.
Recognizing this miraculous microscopic loophole, Dr. Matalewicz shared the discovery with his close friend and colleague, Dr. Ingenious of Lazowski. Now, both of these men had secret ties to the Polish underground resistance. Staring at this harmless strain of bacteria, they began to ask a daring, world-changing question. How do you turn a dead bacteria into a shield to protect a terrified population?
Section 3. Engineering a fake epidemic. Weaponizing fear. Driven by a desperate need to shield their local population from the escalating horrors around them, the doctors engineered an artificial outbreak. They used a methodical three-step protocol. Step 1. Secret injection. When patients came into their clinic complaining of ordinary, minor illnesses, the doctors secretly injected them with the dead Proteus bacteria. Step 2. The mandatory blood test. The doctors processed these tests, knowing full well the results would come back definitively positive for epidemic typhus. And finally, Step 3. Report to authorities. To make the ruse absolutely watertight, they meticulously reported these positive cases to the German authorities. By doing this, they carefully orchestrated the spread of a fake epidemic across a cluster of a dozen surrounding villages. It created a flawless, undeniable paper trail of a massive medical crisis.
Section 4. Fooling the German military. Living on the edge.
Now, designing the plan was one thing, right? But the tactical execution required ironclad nerves. The psychological toll of this deception was immense. Think about it. If a single Nazi health inspector decided to bypass the paperwork and simply perform a thorough physical exam on these so-called typhus patients, they would have found hundreds of perfectly healthy people. If the trick was uncovered, the doctors, their families, and the villagers involved would have been executed on the spot.
But this high-stakes gamble paid off beautifully. Instead of triggering lethal inspections, the ruse triggered absolute panic. Terrified of catching the deadly disease, the German military command placed a rigid, total quarantine cordon around the entire region. German soldiers and Gestapo officers were so terrified that they completely sealed off the contaminated zone and flatly refused to even cross the boundary.
Section 5. The Life-Saving Legacy, a miraculous safe haven.
Because the Germans were entirely too terrified to enter the quarantine zone, the results were astounding. The Nazi military machine stayed completely away. Behind this invisible biological wall, the region was spared from brutal roundups. The local population was protected from forced deportations, and the dozens of surrounding villages were totally shielded from the mass executions relentlessly devastating the rest of occupied Poland.
8,000. To put that into perspective, historians estimate that by meticulously orchestrating this coordinated ruse, these two ordinary physicians successfully infected and protected roughly 8,000 people. Importantly, this staggering number included a significant population of Jewish people who were hiding in the countryside. By literally turning their microscope into a weapon of resistance, Dr. Matilewicz and Dr. Lazowski outwitted an entire military machine using nothing more than a vial of harmless bacteria, ironclad nerves, and a profound, unwavering commitment to human life.
As we wrap up this explainer, we're really left to marvel at the sheer ingenuity and bravery it took to pull this off. It challenges us to look at the objects around us a bit differently, leaving us with this final, provocative thought. If a single vial of harmless bacteria can outwit an entire military machine and save thousands of lives, what other ordinary tools could become weapons of resistance?